Kia ora. This is almost everything you'll need to know about the wrist. We've looked at the carpal bones and the radiocarpal joint in the video on the bones. So this time I just want to concentrate on some of the soft tissue structures around the wrist, and we'll start with the anatomical snuff box. It's bounded by the tendon of extensor pollicis longus here posteriorly and extensor pollicis brevis here anteriorly, and extensor pollicis brevis tendon runs quite closely with the abductor pollicis longus tendon. With careful palpation you can feel that they are separate tendons, but they run very close together. Extensor pollicis longus and extensor pollicis brevis become separated proximally by the dorsal tubercle of the radius, and that means that the gap between them is formed, and that is the anatomical snuff box. It's bounded proximally by the styloid process of the radius and distally by the base of the first metacarpal. In between those bony prominences can be palpated in yourself, or if you're lucky enough, a palpable other, the scaphoid bone, particularly the tubercle of the scaphoid, and the trapezium bone. So those bony structures form the floor of the anatomical snuff box. The contents of the anatomical snuff box are the radial artery. This moves from its relatively anterior position on the lateral or radial wrist to a posterior position. It crosses underneath the tendons, crosses the floor, escapes the anatomical snuff box, and then pierces between the two heads of the first dorsal interosseous muscle. So the radial artery, it is palpable in the anatomical snuff box also, but certainly not as readily as it is here. Another important vascular content is the cephalic vein. This is the origin of the cephalic vein in the anatomical snuff box. It's one of the two superficial veins of the upper limb, and it runs from the anatomical snuff box along the radial border of the forearm. It's formed by the radial arm of the dorsal venous arch, reinforced by tributaries from the thumb. The ulnar arm of the dorsal venous arch forms the basilic vein. Finally, we have the superficial radial nerve, which comes from the radial aspect of the forearm and branches across the anatomical snuff box. Again, they are palpable as they cross the extensor pollicis longus tendon. If we look at the same view but with all of the extensor tendons represented now, a fun activity of anatomists is to take a cross section through about here, as this is where the extensor retinaculum resides, and it has fibers that separate the tendons as they cross underneath and forms tunnels. So if we look at the distal radius and ulnar end-on, we would see most anteriorly abductor pollicis longus tendon here and its close associate, the smaller extensor pollicis brevis tendon. Then we see the tendon for extensor carpi radialis longus. This surprises some people, but it does cross underneath the other tendons, and its little brother extensor carpi radialis brevis. Then we see extensor pollicis longus having just past the dorsal tubercle of the radius. Centrally are the four tendons of extensor digitorum, and they are joined in a compartment by the tendon of extensor indicis. In a separate ulnar compartment is the tendon of extensor digiti minimi, and finally on the other side of the styloid process, the tendon of extensor carpi ulnaris. The extensor retinaculum separates these into compartments. I'll just label them again. This is a favourite diagram. It's in every anatomy atlas and textbook, and it features fairly heavily in anatomy exams. So, ta-da. It's interesting to note that there are 12 tendons that cross the back of the wrist. So if you are learning this, then you know you've got it right. If you've managed to name all 12, you can remember that there are 12 strings by recalling that there are also 12 strings on a 12-string guitar, as in this famous guitar owned by this famous guitarist, Huddy Leadbelly Leadbetter. This guitar said to have been offered to Kurt Cobain for $500,000, but he couldn't afford it, and his producer David Geffen wouldn't buy it for him. In a somewhat tragic irony, Cobain's own guitar was sold for $6 million after his death. So there's that. Of course, we can play the same trick with the flexor aspect of the wrist. This time many of the tendons that cross will be within the carpal tunnel. The most deeply placed are the 4 tendons of flexor digitorum profundus. Directly anterior to them are the 4 tendons of flexor digitorum superficialis, arranged like this at one point, and also the tendon of flexor pollicis longus, also trapped in there with them, or they're trapped in there with it, is the median nerve. The roof of the tunnel is described generally as being the flexor retinaculum, although there's an argument that the true flexor retinaculum is more proximal in the wrist and is a structure that is essentially continuous with the extensor retinaculum, and that this particular structure, the roof of the carpal tunnel, should be called the transverse carpal ligament. But keep yourself safe and just refer to it as the flexor retinaculum for the purposes of your exams. In a separate tunnel here is the tendon of flexor carpi radialis. So that's not in the carpal tunnel. So the carpal tunnel only contains the long flexors of the digits, all of the digits. The 4 fingers having 2 flexors each, and the 1 for the thumb. There is another flexor for the thumb, flexor pollicis brevis, obviously, but that is a muscle of the thenar eminence, a short muscle of the hand, which we'll see in the next video. There's the tendon of flexor carpi ulnaris, which attaches to the pisiform here, and then also works its way around to the hook of the hamate on its way to the base of the 5th metacarpal. Finally, we have the tendon of palmaris longus, superficial to the carpal tunnel. And for those of you that like to count, that also makes 12 tendons that cross the wrist in the flexor aspect. So that's a happy coincidence that makes life easier for the lucky anatomy students. But if you do need another visual prompt to remember 12 strings, sorry for the pixelation, but here's another 12-string guitar, this time played by some bloke who's just having a go. Looking at this more complete picture, we see palmaris longus here blending with not only the flexor retinaculum, which we'll call it for safety's sake, but also the palmar aponeurosis. If we remove those structures, then we can see why some people argue that this should be called the flexor retinaculum and this should be called the transverse carpal ligament. Removing that controversial structure, we can see the tendons of the digits in the carpal tunnel, flexor digitorum superficialis. For some reason they've shown these 2 joined. Don't think that actually happens. Flexor digitorum profundus. These have the lumbrical muscles or lumbrical muscles attached to them. These muscles here. Removing them, we're left with flexor pollicis longus here, which ends up here. That's almost everything you need to know about the wrist. Next time we'll finish up the upper limb by looking at the hand. Until then, enjoy the rest of your day. Ka kite.